Welcome to Making Rounds on PlanetVero Radio and TV. And here's your host, Jennifer Toby and Treasure Coast Compassionate Care.
Good afternoon, everyone. We are back today with part 2 of our show with Dr. Sarbak and Amanda from Premier Plastic Surgery and Spa. I write that down because I don't want to mess it up. And Marty, the Colonel, is here today. And we are going into part 2 of the show where we're going to do a procedure today. And you are going to kind of give an idea of what women or men, when they come in, would expect to hear. Kind of, I guess you'd call that a consultation, right?
Yes.
Just kind of where we start, where we can go, and the options that we would have to make it all better. So, and then we're going to do the Botox live on the air today. So I can show everybody, and anybody who knows me, y'all know I am the biggest baby in the world. Like, I do not like needles. I don't like giving injections. I don't like getting them. And it's really very painless. I mean, I was pleasantly surprised with how little pain involved. And, you can just go right back to work. You can sit here. You can't really tell that you've had it done, and you can go to Target afterwards if you want, and you don't look like the Elephant Man or anything. And so we'll start with that, with the procedure. And then we'll talk a little bit more about the men's part that we were talking about in the last show. You were asking about the eyelid surgery, and you had said that that's something that's really frequent with men, having the eye lifts, the lid.
It's very common, the upper eyelids, and a lot of times it is covered by insurance. And there are simple eye tests that your eye doctor, your optometrist, or your ophthalmologist can do that will qualify you.
Okay.
You kind of have to fail the test, but if you fail the test, you qualify for the procedure.
Yeah.
I could probably do that.
Well, that's really neat to know that it's could be covered by insurance. Because I'm finding that more and more procedures are, right? They're covering them if there's a need.
Well, this in particular, yes, because it blocks your visual field. Mm-hmm. And it's if you think about it, it's actually a danger if you're driving and
right.
And you can't really see, everyone's at risk out there, including yourself.
Right.
Yeah, particularly at nighttime. As the more senior you get, the harder it is to drive at night.
Yeah.
And a lot of people that don't go through cataract surgery, they just put it off. Driving at night gets tough. And if you can't see well along with it, you need to get serious.
Yeah.
My wife's uncle was 86 years old when he decided to do his. And a month later, he went back to hunting because he couldn't figure out why he couldn't hit the deer or see them before it was too late and scare them off.
Oh, my goodness. So he had the lift, and now he's back to hunting again. Well, that's neat. I know a lot of women have that issue, too. I notice the older I get, like, this isn't as... as it once was. So that's my mother. That's the one thing that she wants to have done is the lid and underneath, and I'm very sick, so you can see it all underneath my eyes, and you can do all kinds of fun stuff for that too. But I'm going to go ahead and let you go ahead and start and just do what you have to do. Tell the whole world how bad it is. So
in our office
over here,
after we've welcomed you, we take a medical history to make sure that we have the proper background. We know what procedures you've had. We know what medications you're on.
Right.
We know what conditions you may or may not have that influence what we're going to recommend.
Right. Okay.
And I'll head over your way. You're brave, and
I'm brave.
You've agreed
Let's do it.
Let me give you a full assessment.
I can't fix it whatever you want to do. Let's do it.
All right.
All right.
So, I like that your hair's pulled back because that lets us see everything.
Yeah, I know.
Your forehead is actually pretty nice right now.
Okay.
You may have some of the Botox still working from the last time you did it.
Okay.
Your eyebrow position looks pretty good. It should be above your bony rim, and it is. The shape is nice. You have a little bit extra skin in your upper eyelids, but it's not to the point where, let's say, Marty might be.
Thank you.
That's good.
That's good.
Now, your lower eyelids, and it can be made worse by, illness or sinus problems, allergies. but I see a couple of things. Excuse me. There's a little bit of a hollow appearance between your lower eyelid and your cheek, and that separates those two visually.
Right.
So then that becomes eye-catching.
Right.
Okay? And part of that is you've lost fat in that area that's depressed over time, and part of it is some of the fat around your eyelid is bulging.
Okay.
And there are compartments under your eyelid that are doing that.
Right.
So from a technical standpoint, the best thing for your lower eyelids is probably eventually surgical.
Okay.
Where we would replace some of the depression that you have with either your own fatty tissue.
Oh, okay.
Or a filler like Restylane.
Okay.
And then we would possibly contour down some of your fat pads and then tighten your muscle.
Okay.
And then tighten your skin a little bit.
Okay. So a little bit of...
Any incision for that would be right under your eyelashes.
Oh, wow.
And it would bring things like that.
Awesome.
Still look natural.
Okay, natural. We want to look natural.
Is key.
Okay.
Now, overall, your skin looks pretty good.
Okay, good. Well, thank you.
So whatever you're doing.
Okay. Thanks, Debbie. That's my Mary Kay.
It's holding up nicely.
Okay.
Now, you did mention your 11s.
Yes.
When you make a stern face, you see them. So there are muscles right here that are triangular in shape, and they come together and they form those two 11s. That's what Botox was originally indicated for. And that is the place we started using it.
Okay. Yeah.
That should get at least 90% better with Botox.
Okay.
Because what you're doing is paralyzing the muscle that makes the wrinkle.
Okay.
And every time that muscle moves and flexes, it's attached to the skin.
Okay.
And it makes the skin bend.
Oh, okay.
That's how wrinkles come.
Right.
So in some people, those wrinkles get worn in to the point where if the muscle's not working, they still have a wrinkle.
Right.
And they need a filler, which is like spackling.
Okay.
So
that makes sense.
Pumping that in
to
bring
kind of
out that little depression and puff it out.
Okay.
Now, Botox lasts about 3 to 4 months. And a filler usually in that area lasts a year or longer.
Oh, okay. That's good.
So
it kind of brings out that little indentation. And the first time I did the Botox, it did go away. But this last time, it didn't. So I might be ready for the double.
You might be able to get away with it.
Okay.
You would know within about, let's say, 3 weeks.
Okay. So we'll be back in 3 weeks to see. All right. Okay. So what do you think around here? This is I was telling you that I wanted new puffy lips and my husband's so against it. Is this something that,
Well, I think you're starting with good lip shape, right from the get-go. I would be subtle with your lips.
Okay.
But there are different fillers that have been designed. One of the most recent is Volbella. It's very soft.
Oh, okay.
And that's probably the most realistic feeling filler.
Okay.
There are other fillers, some of the older ones, which still work great, like Juvederm Ultra Plus.
Right.
That's really when someone's lips are fine and you want to get a nice effect.
Okay. More extreme.
In you, I would probably try to define the part between where the white skin meets the red lip.
Okay.
And sometimes where you get lipstick bleed.
Yeah.
It would just kind of puff out that area and define it. But I don't want to scare your husband.
Okay.
He's bigger than you.
Yeah. Okay, good. So just a soft, subtle, little poof.
Correct.
Okay. Well, that's next. Okay. All right.
And then...
No, gosh.
All right. Well,
go ahead. No, go ahead.
Going after everything. You have a little bit of a fullness right here. Okay? At some point, not right now, but you're probably going to go this way.
Right.
With surgery. Not right now.
Okay.
But there are ways to hide this when it's small.
Oh, okay.
And that's with a filler.
Oh.
So you can actually inject a filler into this little hollow and it'll mask that. And you can actually go behind it because you actually lose fat in this area and it elongates your jawline.
Nice.
And those fillers, that's Voluma. About 60% of that's still there in 2 years.
Oh, wow. So it does last a while, these investments that you're making into yourself.
You have to be careful in what fillers you choose. There are some fillers out there that have a permanent component, which at first sounds great, except your face is going to age over time and change.
Right.
And if the filler doesn't, at some point, you're in trouble.
Right, because it's still like stuck in place, and then your face is and thinner, the skin gets thinner, and so you can...
And most of the people that are injecting those permanent fillers are not plastic surgeons, so if you have a problem, they can't fix it anyway. Right.
So this is super important, everybody. You need a plastic surgeon, to do your procedures, not just anybody, or you're going to look crazy in about 5 years, or maybe the next day. So with that being said, what else? Anything else that we need?
Well,
now that you mention it,
I know.
A little bit. Your neck is pretty good. When you do tuck your chin, there's a little bit of extra stuff.
Okay. I'm just going to go home now. No, that's good. Okay. Well, I'm 46. There's extra stuff everywhere. So,
the important thing that I want to stress is I can point out lots of things in lots of people.
Right.
But it really comes down to what bothers you.
Right.
And then we have to figure out what bothers you, what you're focused on, and the best way to get you to the results. Because some people say, hey, I want to go right to surgery. And some people never want to see.
Right, right. So these are subtle things that you can do without just, pulling my whole face back over my head yet. Okay. All right. Well, with that being said, we're going to shoot over to commercial real quick, and then he is going to give me my Botox, and we're going to show you just really how painless it is, and then we'll talk about it a little bit more. Maybe we'll pick Marty apart real quick. And we'll be right back.
You don't have that much time in the show, dear.
We have to go to another garage sale. You do know there's a better way. You can get phenomenal stuff and great deals on almost everything at our Habitat Restore.
Hey, isn't that where you got your office desk?
Find great stuff at the renovated and expanded Indian River Habitat Restore on US 1 just north of 45th Street. Open Monday through Saturday from 10 a.m. to 6. Donations of gently used stuff is always appreciated. Shop, donate, volunteer. Habitat Restore is a nonprofit.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew. Are you a therapist or a nurse seeking the multi-state compact license? In the state of Florida, these and many other industries require a Level 2 live scan background check for clearance to work in your industry. A1A Fingerprints is your certified live scan source from Broward to Brevard. And if you're a medical provider, you need to be registered on the ACA web portal. A1A Fingerprints will help you navigate and comply with the law. Call 772-494-6556 or visit a1afingerprints.com. A1A Fingerprints.
Maison Martinique has a mini menu with smaller portions and discounted prices. They have a lobster special creation every Wednesday. Don't forget to ask about business luncheons and wedding receptions. Open at 5 p.m. Maison Martinique. Award-winning dining. Come to Havana Nice, a piano bar with spirits and a fun menu. Havana Nice is a home of 2-for-1 happy hour Sunday through Friday, 5 to 7. Football Sundays and a free taco bar and drink specials. Opening 4:30 daily and 1 p.m. on Sundays. Caribbean Boutique Hotel, South Ocean Drive. Member of the ITEX Trading Community. ITEX Dollars, so welcome.
The Cataract Institute at New Vision Eye Center is the first place on Florida's East Coast to offer the Varian high-definition imaging system, bringing custom cataract surgery to a whole new level. Dr. Paul Minotti and Dr. Stephen Tate are pleased and honored to now provide the Varian image-guided system to further enhance visual outcomes for their patients. Call New Vision Eye Center for a consultation or second opinion. Your eyesight deserves world-class eye care. Visit newvisioneyecenter.com or call 772-257-8700.
And we're back. So now that you guys heard all of that, and it was pretty painless. He was very kind, I'm sure, since we're live on air. But we're going to go ahead and we're going to do the Botox. And we did some before pictures before we started today. And we're going to show them throughout the next few weeks some pictures and maybe a couple more things that I might be having done now that has been pointed out. But we're going to start with the Botox and just kind of show how quick and easy and effortless and painless it is. So.
All right. First thing we want to do is clean the area. A little alcohol pad. And what we're focusing on today are the 11s.
Mm-hmm.
So we're trying to shut down the muscles that are creating those wrinkles. So what you're going to feel, usually in the office, we have a chiller, which even takes more of the edge off. What you're going to feel, a little pinch. Another one. Doing great. You're even breathing.
Mm-hmm.
That's perfect. Another one. Touch right here. The muscle actually extends in you a little laterally. That's okay. It's like a triangle. Last one. You did it. So how did that feel?
I honestly didn't feel anything. Like I felt you squeezing, but I didn't feel a thing. So that was I'm pleasantly surprised that I could feel it going in deeper than the last time I had it done. Like it felt like it was deeper, but I didn't feel anything. Does that make any sense? I don't know. Maybe I just made all that up, but that's what it felt like. But I didn't feel anything, and that was. Kid, do I have big, ugly bumps or anything? Can you see
those bumps? For
yeah,
5 minutes.
Yeah.
Go away.
But it didn't hurt. So you can see, honestly, how painless it really was. And so pretty soon, what'll happen is you won't be able to see those move anymore. And so you don't see those big indentations right there, which is really, it makes a big difference when you can't see all those lines, you know, that makes you look a little bit younger. So, and it's funny because my daughter had said the first time I had it done, I came back and she was joking with my son. And I thought they were making fun of me or something because they were giggling. And I said, "What are y'all laughing about?" And they wouldn't say. And finally, I was like, "Stop making fun of me." And Jake goes, "Well, she's not. She asked if you got anything done because she hadn't seen me since I had the Botox done." And I said, "What do you mean?" What do you mean? And she goes, "I don't know. You just look different." So I asked Jake if you had done anything. And I had the Botox, and he knew it because he went with me. And so my daughter, who, you know, I hadn't seen her in a couple of weeks because I was here. I live in Houston and here. Had noticed. So it kind of made you go, oh, okay, so people, it does kind of make you look like, you know, it's not as noticeable, all those wrinkles.
Well, what it does also, it's tougher to make a mean face.
Yeah.
So if you're angry at someone, you might have to tell them.
Right. Well, I'm okay with that. My kids are obviously okay with it. But it does. The Botox was my first jump into like trying to do something to, I guess, reverse.
The gateway.
It's the gateway, yeah, it is. It really is, because now I'm like, I want my lips done, and I want this done, and now I want all those things that you just pointed out. So that'll be happening too. But, you know, men also do this, correct? Like the men are doing Botox and the fillers, and it's important, I guess, for them to do. Are they doing like moisturizing routines and things like that as well? Or
they are. Men have a little bit different... They have a benefit that a lot of women don't because they shave.
Yeah.
So they essentially exfoliate every day.
Oh, wow.
So that's definitely a benefit.
Yeah.
In guys, the most popular location for Botox is right between the eyes where we just did it.
Oh, okay.
And when you do Botox, it takes about 5 to 7 days to really set in.
Right.
And it usually sets in where one side goes before the other, but you kind of know. And then when it wears off in 3 to 4 months, you definitely know.
Right. Yeah.
And then that's time to come back.
Right.
But guys, a lot of times have that deeper worn-in wrinkle that needs a filler as well as the Botox.
Yeah.
And I got to say, Marty's is a little on the deep side.
Yep.
So he would probably need both. The other thing that works well in guys is they lose a lot of volume in the cheeks. And Marty, did you ever have anything with your right cheek? Because you have a little bit more volume loss on that right side.
No, other than
Your turn.
I have a scar there from.
What's that?
That was when I was 18 years old playing basketball. Some kid ran into me and with his teeth. And that's a tooth. That's a list of teeth.
You can fix that.
You actually may have had some soft tissue that kind of either scarred in or just kind of atrophied away. But something like that, you can usually kind of plump out and restore the contour with a filler. The other thing you mentioned earlier is about, skin cancer.
Right.
And one of the things we talked about was laser resurfacing. Believe it or not, that actually helps protect you against skin cancer because it's kind of blasting away that top superficial layer of damage.
Oh, nice.
That's interesting.
So I have had a fair amount of guys actually come in for laser, and they're not as worried about the wrinkles as they are as protecting their skin and staying away from, having to go to surgery for a skin cancer.
Especially in Florida. Right. I mean, it's I hate to say notorious, but it really is because, and the younger you are, the more you tend not to take care of yourself.
True.
So that's something that you can do throughout is do that lasering, right? If you're in the sun a lot, that'll help keep, it helps prevent. It's a preventative.
And then you have to, like Marty said, you have to be good and wear your sunscreen and your hat. And try to go out early and late and not bake yourself in the sun.
Yeah.
And we have a fair amount of guys now who are doing facial surgery. Even beyond eyelids, they're figuring that they've got some jowls and some loose skin in their cheeks and their neck's starting to hang, and those things can be tightened up. I think it's very important, probably even more important for guys to look natural.
Right.
Because you mentioned Kenny Rogers.
Right. Nobody wants that.
That just, it's eye-catching. You see someone like that in a restaurant, and you're just staring at them the whole time.
Right.
Yeah. And that's going to turn you off.
Yeah. There's no point in doing it if you're not going to look like yourself, or you're, you just have that plastic, and you see it so often, that look, you can just spot it.
You want to look natural. You want to look good.
Right.
And in guys, it's a little bit tougher because we have to hide the incisions, and women can wear makeup while they're healing.
Yeah.
Not a lot of guys are, good at, putting concealer on.
Yeah.
So it's either, one of those things where you kind of hide out for a little while, or you don't care and you just go out.
Yeah.
And do what you're used to doing. But there are a lot more guys doing surgical procedures than in the past.
Yeah, I think the macho image, if you will, has died down a little bit. With people, and they're more concerned with really what do I look like when I'm in a mirror,
right?
And if I was 20 years younger, I'd be wildly enthused about that.
It's never too late to freshen up.
Well, if you think about it, really, if you look at the way your parents were, people feel a lot better at older ages now. They're more active. So, really, 70 is, the new 50.
Right.
It really and truly is.
I hear that a lot.
I remember my grandmother at 50, she was granny.
Right, yeah. But it's just not the case anymore. And so I think it's neat that men and women are all doing it, and you have all these options.
This has been really neat.
It has been, right? It's enlightening.
It's been very informative for me, and
well, if you decide to get that filler, Marty, and you mentioned that you saw it on this show, you get a complimentary facial through the center. And so if you decide to get any fillers, you get a complimentary facial. And we're super excited that that you guys came on today. I can't thank you enough. And everybody in town was so excited to have you guys here. And hopefully I look like a brand new me in 3 weeks. A happier one anyways. Thanks y'all for coming today. I really appreciate it. It was fun.
Well, thanks for having us.
Thank you.